This clip aims to demonstrate how to perform the acknowledgement of receipt of funds received by clinics, hospitals, and district health executives under the National Results-Based Financing Program. The purpose of this clip is to ensure that health facilities and DHEs confirm receipt of funds disbursed under the RBF program correctly, accurately, and timelessly. The target audience of this clip is district accountants, district medical officers, who both co-sign the acknowledgement of receipt of the funds. The 3 documents required are Acknowledgement of Receipt of Funds Received form, bank statement, quarterly invoices for all clinics, hospitals, and district health executive. Step 1. Collect documents. After receiving notification of disbursement of funds, obtain the current period bank statements for all RBF contracted clinics, hospitals, and district health executive for the district. Step 2. Form completion. On the form shown, fill in the DHE's address, followed by the province, which is Midlands, the district, which is Mvuma, and the date of acknowledgement, which is 10 April 2019. Step 3. Health facility name. Fill in the name of each health facility. In this instance, we will start with Brockwood Clinic. Copy the name as it appears on the invoice sent by the National Purchasing Agency. Step 4. Health facility earnings. Fill in the facility earnings for the quarter as per the invoices received from the paying agents. In this instance, it is 1,419.93 cents. Step 5. Health facility amount received. Fill in the amount received for each health facility as per bank statement. In this instance, it is 1,419.93 cents. Step 6. Reporting period. Fill in the precise quarter and the year for which the funds have been received. In this instance, the quarter paid is Q4 2018. Repeat steps 3, 4, 5, and 6 for each health facility. Ensure that every health facility is recorded, ensuring the total number of health facilities and 1 DHE are listed on this form. Here is a summary of key documents and figures. Record the health facility name as shown on the invoice, earnings for the facility from the invoice, and the actual amount received as shown on the bank statement, not forgetting the reporting period. Check if earnings as per invoice tally with the actual amount credited to each clinic, hospital, and the DHE bank account. If there is a difference, please check the documents again to make sure that a mistake has not been made before concluding it is an over or underpayment. Step 7. Calculate totals. Add the facility earnings column and the amount received column to get totals for each column. Step 8. Sign off. If the information is correct, the district accountant and the district medical officer should sign and stamp the form. Reporting on over or underpayment. This can result when a facility's earnings are greater than the amount received, resulting in an underpayment, or a facility's earnings are less than the amount received, resulting in an overpayment. Scenario for over or underpayment. The NPA in their invoicing printed an old invoice whose invoice elements/indicators were later on revised. This resulted in the NPA processing payment based on the old invoice of $1,600. Later on, the correct invoice was sent to the district, and this resulted in the accountant recording facility earnings of $1,800 compared to the amount received of $1,600. This resulted in them recording the underpayment of $200. The underpayments will be settled in the next quarter by the NPA, and in the case of overpayments, the deductions will also be made in the next quarter. Please take note of some of the common errors, which are Transposition of figures of the amount shown either on the bank statement or the invoice received from the NPA when writing them on the form. Lozike Rural Hospital had an invoice showing earnings of 1,362.62 cents, but the accountant wrongly recorded earnings of 1,326.62 cents and recorded the correct quota paid. Taking incorrect figures from the bank statement as the amount received. Tsanza Guru Clinic had an invoice showing earnings of 1,479.35 cents, but the accountant wrongly recorded the running balance of 3,505.90 cents as the amount received and recorded the correct quota paid. Taking incorrect figures from the bank statement as the amount received. Sidubu District Hospital had an invoice showing earnings of 17,449.35 cents, but the accountant wrongly recorded the final balance of 21,098.96 cents as the amount received and recorded the correct quota paid. In summary, the common errors are transpositioning amounts shown either on the bank statement or the invoice received from the NPA when writing on the Acknowledgement of Receipt of Funds form. Taking the final bank balance at the end of the month as per bank statement as the amount received, or taking the running balance on the bank statement as the amount received. Omission of the quota being paid. Creating a new Acknowledgement Receipt of Funds form and not using the form shared by the program. Overriding information from the previous quarter and leaving some information from the previous quarter. Inaccurate facility earnings which are not in line with the amounts received. Not signing and stamping the form. Omitting DHE and hospitals in the district. Important note: the acknowledgement of funds received should be done within 14 days after notification of disbursement of funds, or otherwise communicate any challenges. Accuracy is critical when acknowledging receipt of funds, and re-performance of calculations must be done every time before concluding there is an over or underpayment. This clip is brought to you by Crown Agents and the Health Development Fund.